Hello, Dr. Uswiki here, and welcome to today's lesson. In today's lesson, I'll be sharing tips and strategies to help support our elementary learners with EBD. What is EBD? EBD is an emotional disorder characterized by excesses, deficits, or disturbances of behavior. These deficits in behavior are usually emotionally based and cannot necessarily be adequately explained by intellectual, sensory, or even health factors. It is important to remember EBD symptoms vary from child to child and will look different from one elementary learner to another. Some of the characteristics and behaviors present with elementary learners with EBD and emotional challenges typically include abnormal mood swings, excessive anxiety, aggression or self-injurious behavior like fighting, acting out, isolation and withdrawal, especially from large groups or social gatherings altogether, depression, impulsivity, bipolar disorder, and schizophrenia. Again, it is important to remember that early evaluation, early intervention, especially in collaboration with the appropriate caregivers and service providers for our elementary learner with EBD, is the best way to ensure growth and guarantee emotional and behavioral improvement. I'll be sharing 7 tips and strategies to help support our elementary learners with EBD. Tip number 1, modeling, rehearsal, and feedback. To support our elementary learners with EBD, modeling is skill, concept, or directive, while immediately having our elementary learner with EBD rehearse the skill and providing direct and immediate feedback about their performance is a great, supportive, and helpful tool. Skill number 2, live space interviewing. What is live space interviewing? Live space interviewing is a crisis intervention technique in which our elementary learners' emotional crisis or emotional challenging behavior is discussed with the child at the time of the incident's occurrence. This is necessary as our elementary learner is most receptive to ideas for change when he or she is in crisis. Tip number 3, sequential prompting. Sequential prompting is simply the use of multiple levels of prompts, especially in order of most independent to most dependent on the teacher and adult for support to increase and to maintain their academic performance. Tip number 4, mnemonic instruction. Mnemonic instruction is a memory enhancing strategy or memory boosting tool that simply relies on the use of a rhyme, poem, acronym that is especially linked to prior information or background knowledge that our elementary learner with EBD possesses to help them retain new concepts and information. Tip number 5, personalized and individualized instruction. Our elementary learners with EBD benefit from segmenting instruction that's tailored to their individualized interest and attention, especially when broken down into smaller chunks and units. Tip number 6, incorporating student interest. Aligning lessons and concepts and tasks, especially to topics of interest or ideas of interest to our elementary learner with EBD, is a great way not only to sustain their attention, but it also increases their interest and participation to the task or assignment at hand. Tip number 7, positive behavior intervention strategies. The use of positive behavior intervention strategies, positive reinforcement, rewards, praise, are a great way to encourage and support our elementary learners with EBD to maintain positive behaviors, interactions, and also positive self-regulating checks. To help us, I have created a list of these tips and strategies. Please visit my website to download your free copy of these tips. Thank you for learning with Dr. Usweke today. See you in the next lesson.